Meningitis is an inflammation of the membranes surrounding your brain and spinal cord. Viral meningitis is the most common and less severe form and often resolves without specific treatment. Viral meningitis requires rest, hydration, and over-the-counter pain medications to reduce fever and relieve body aches. Bacterial meningitis is more severe and can be life-threatening if not treated with antibiotics and steroids. A spinal tap, also known as a lumbar puncture, collects cerebral spinal fluid to confirm or rule out meningitis since it detects the bacteria and viruses that cause the condition. Did you see the This is Spinal Tap movie? It's worth it, and they are working on a sequel now. Meningitis symptoms include sudden high fever, severe headache, stiff neck, confusion, seizures, sleepiness, and sensitivity to light. Good hygiene practices such as hand washing and covering coughs and sneezes help prevent the spread of meningitis. Welcome back to another episode of Paula Marie Close Ask Dr. Paul. Today we're going to highlight the thermoplastic processing technique, injection blow molding. So when your boss talks about IBM, what do you need to know? Injection blow molding, or IBM, is a manufacturing process that produces hollow plastic objects in large quantities. IBM is similar to injection stretch blow molding without using stretch rods, yet it has injection molding and blow molding tooling similar to ISBM. The IBM process typically happens on a horizontal three-station machine, which includes the injection molding or preform station, the blow molding or bottle station, and the bottle ejection station, in which a stripper plate ejects the bottles from the core rods. ISBM differs from IBM machines, and you might remember in a past That's Working Knowledge video that ISBM machines have vertical movement of the core and stretch rods, and a lip cavity transfers preforms and bottles from station to station. In the injection blow molding process, the plastic is injection molded onto a core rod, making a preform like ISBM. However, the IBM core rods then transfer these preforms by rotating to the blow molding tooling so the preform can be inflated and cooled. Like ISBM, the preforms cool from the melt and bottles are blown at the best temperature and pressure combination. I like to compare the preform consistency to warm taffy for good bottles, and you will not make bottles if the preform is too hot because it will pop like bubble gum, and again, no bottles if the preform is too cold because it can't expand with air, being glassy and too rigid. IBM, like ISBM, makes detailed threads since the preform is made while surrounded by the steel of the core rod and the injection molding cavity. And you know this since the inside of preforms and bottles around the threads is always smooth. Bottle blowing occurs only below the threads since these threads are surrounded by steel in the blow molding tooling and do not move. The IBM process is used to manufacture polyolefin pill bottles with good dimensional stability, and they do not leave gate vestige at the bottom of the bottle since the vestige flows and disappears as the preform is blown or stretched in the blow molding station. Common materials used for IBM include high-density polyethylene and polypropylene, which both stretch much less than PET. High-density polyethylene is known for its strength, durability, resistance to impact, and low cost, making it ideal for products like pill bottles that need to be strong but lightweight. Polypropylene is also used for bottles due to good clarity and heat and chemical resistance, which are essential properties for containers that store medications and vitamins. The IBM process allows for the production of bottles with designs and specifications tailored to the needs of the product they are intended to contain, whether it's a child-resistant pill bottle or a container that needs to be squeezable for easy dispensing. Knowing the injection blow molding process and the small medicine bottles it produces, that's working knowledge. Remember to like, subscribe, turn on notification, and even share if you appreciate the content. You can visit our website to learn more about our upcoming polymer processing course. I'm Paul Nash for Paula Marie Close Ask Dr. Paul. Thanks for watching.